Dear ladies and gentlemen, my presentation topic is infection, bronchitis, HRE vaccination, comparison between traditional spray vaccination and the newly developed gel delivery system in field condition. Still, many poultry veterinarians believe that gel vaccination is inappropriate during HRE vaccination against respiratory disease. The aim of this study was to assess the applicability of the infection bronchitis gel vaccination at the hatchery in typical field condition in a large-scale trial by comparing gel administration, a newly developed patented system, to the spray vaccination considered as the reference method. The avian coronavirus, the causative agent of infection bronchitis, is one of the most relevant and impactful pathogens to affect the poultry industry worldwide. The infection bronchitis virus belongs to the genus Gamma coronavirus, family Coronaviridae. We know and studied the coronavirus more than 60 years, but is still causing surprises. The virus is widespread globally and very contagious. Some virus particle is enough to cause the disease. We have effective vaccines, but the virus has many serotypes. The infection bronchitis virus is responsible for a specific respiratory sign in chickens of every age, but tend to be more severe at early ages. Depending on the pathogenicity of the strain involved, IBV may also damage the kidney and oviduct, and in this case, resulting in drops in egg production and egg quality. Mortality is usually low, but it may increase significantly in case of secondary infection by pathogens such as E. coli or Mycoplasma. Interactions with other respiratory or immunosuppressive viral disease has also been documented. The parent's live or inactivated vaccination or infection provide passive immunity to the offspring. The development of local immunity is provided by the mucosa, IgA and IgM, in the tears and the trachea to protect the respiratory system. The development of the circulating antibodies ensured by the live and inactivated vaccines important to protect the reproductive system and the kidney. The cell-mediated immunity is also playing a role in the immunity. The maternally derived antibody providing protection of the newly hatched day-old chicks, but we are doing the day-old vaccination in the hatchery, then using live attenuated vaccines by drinking water or spray method during the rearing period according to the vaccination program of the flocks. We are trying to extend the protection with different serotype vaccines. Recently, the spray is the most used method in the farms. The layers and parent stocks are vaccinated by inactivated vaccines as well at the end of the rearing period. Each of the mentioned is very important for the protection of the individual and the herd farm level. Mucosal-associated lymphoid tissue MALT providing the mucosal immunity. This avian MALT consists of lymphoid cells that are mainly located in the lamina propria mucosa and the thallus submucosa of the mouth and the respiratory tract. As such, It forms a first line of defense against harmful antigens that enter the body during feeding and breathing. The nasal-associated lymphoid tissue, NALT, is one of the most important places of the upper respiratory system in the nasal cavity. Most space of the chicken's nasal cavity is occupied by the turbinates with mucosa. Most of the lymphoid tissue is present around the choanal and infundibular clefts, just rostral to the pharyngeal papillae. Although this lymphoid tissue is not well organized and is devoid of crypts, it's often designated as the pharyngeal tonsil. The Harderian gland is located behind the eggs of the chicken, and its function is not clearly defined, but the location of the immune response. It is a relatively small tissue. The lymphocyte from the bullseye migrates to the Harderian gland prior to hatch. The Harderian gland is known to contain many B and T cells, playing an important role in the local immunity. The trial protocol. The dairy hatch was roughly 110,000, and 105,000 chicks were vaccinated by spray, and 5,000 chicks were vaccinated by gel. We checked the body temperature of 25 randomly selected chicks from both groups before and after the vaccination. All the three formulated groups were vaccinated by Massachusetts and variant strains of IB vaccines, and the third group received coccidiosis vaccine as well. From all three groups, we randomly selected 50 chicks, and the spray and gel vaccinated chicks received wing beds for the identification. All the three groups were settled into the trial facility pens of the veterinary university. The spray and the gel vaccinated groups were sampled for PCR at day 4, 8, 12, 16, 18, 21, and 35 individually. The third coccidius vaccinated group wasn't samples, it received a feed without coccidiostat. All groups were blood sampling at day 21 and 35 of age. Spray vaccination. Clear trend towards hatchery vaccines administration has been observed recently in the intensive poultry farming all over the world. The hatchery vaccination offers many advantages, such as lower labor cost and improved standardization of the administration procedures and conditions compared to the farm vaccination. The company in the hatchery has a smart count with a spray cabin which providing 15 ml vaccine spray for a box with a droplet size 200-250 micron. Vaccine intake was assessed by visually inspecting the chicks. After administration, the spray vaccinated birds appeared wet and stained with blue dye solution. Gel vaccination. Gel administration has recently drawn some interest as an alternative route for IBD vaccine delivery at the hatchery. Superabsorbent hydrogels are materials with a three-dimensional framework that retains stability even after absorbing large amount of water. In the poultry sector, they have been used for a long time to supply live coccidious vaccines and more recently probiotics and prebiotics. The application device allowed to an accurate delivery of the hydrogel by automatically controlled the shape, size and the distribution of the gel droplets. 45 grams of the gel containing a mixture of 90 doses of the two vaccines were administered to each box, means 0.5 gram per chicks. Vaccine intake was assessed by visually inspecting, and additionally vaccine ingestion was evaluated by individually checking whether the chick tongue was blue tinted after 15 minutes. A few chicks were checked in the proventriculus as well. Paper box administration of the vaccines. Administration in plastic box. Results of body temperature measurement. The cloacal temperature of 25 randomly selected birds from each group was measured at takeoff and then 10 minutes and 1 hour after the vaccination. During that time, the two groups were kept in separate boxes in the chick holding room at 24 degrees centigrade. The spray vaccinated chicks' temperature decreased around 1 degree Celsius, while the gel vaccinated chicks' temperature remained at normal levels. Spray administration at the hatchery may result in a sudden drop in body temperature during this critical phase of the chicken life, when the thermoregulatory system is not fully developed and they still act as poikilotherms, possibly affecting their growth and well-being even in later age. Gel vaccination compared to spray vaccination, it may also have the additional advantage of the lesser impact on chicks' body temperature. After the vaccination, the birds of the trial were individually identified with wing bands, and the three groups was transferred to the university and was settled in separate pens. Every aspect of the management, like housing, feed specification, lighting, was conducted following the Ross Broiler Manual recommendation. The sampling for PCR were taken from the palatal cleft. Results of individual PCR tests for both vaccines. All animals tested positive for Massachusetts and variant vaccines from each group at least one sampling point. Some birds were already positive for the variant vaccine at 4 days of age, and it was still 35 days. Individual variant vaccine detection were more frequent in spray vaccinated group. Higher number of mass vaccine detection were observed in gel vaccinated group, where the detection period from 8 days to 35 days was slightly delayed compared to spray vaccination. In every group, the number of positive individuals peaked around 16 and then started to decrease. This table presents the vaccine titers. 10 swabs were analyzed for the replication of live attenuated vaccines from both groups at all sampling points. The variant 196 vaccine titers peaked at 12 days of age in both groups administered spray or gel. The gel-administered H120 vaccine peaked at 8 days of age and the spray-vaccinated group at 16 days of age. In both groups, the H120 vaccine titers started to decrease temporarily at 12 days of age when the 191 vaccine titers were at higher point. No statistically significant differences between the two administration methods in any sampling point with the exception of the H120 vaccination at 8 days of age. Vaccine titers also show that they were higher with spray vaccination but decreased earlier. Serological test result. Titers were significantly lower than maternal antibody values, and a slight increase was seen by 35 days. For gel vaccination, titers were slightly higher, but not significantly. Conclusions. The gel vaccination has no effect on the day-old body temperature, while the spray vaccination decreases it around 1 degree centigrade within an hour, so it can cause a cold stress. The group vaccinated with coccidius vaccine as well reached the Ross standard weight and no evidence of coccidiosis. The mass strain was detectable between 4 and 21 days in the case of spray vaccination and between 8 and 35 days for gel vaccination. The variant strain was detectable at all sampling points, 4 and 35 days, in both groups, but titers were higher in the gel vaccinated at a later stage. There were no difference in the serological result. Gel treatment options for hatchery administration could be the following. Administration of vaccines against respiratory disease. Administration of probiotics and prebiotics. Administration of coccidiosis vaccines. Administration of bacteriophage products. Or applying all this together. Thank you for the listen.
Thank you for that valuable presentation, Doctor. Now the stage is open for questions. Please feel free to ask as the speaker is available now. I assume that you have no questions from the speakers. Once again, I thank you for being a part of this webinar, Doctor, and I hope to associate with our future events.